Hi everyone, this is Dr. Praveen S. Patil here. On July 15th, we celebrate Susrutacharya Jayanti. We won't get any references about the nakshatra or tithi of the Susrutacharya birth, but All India Institute of Ayurveda, that is AIIA, New Delhi, has started celebrating Susrutacharya Jayanti on every July 15th from 2021. On this day, we can recall the contribution of Susrutacharya to the field of Ayurveda and as well as surgery. In this video, we will come to know the genealogy and contribution of Susrutacharya. Susrutacharya belongs to 7th to 6th century BC. It has proven that. So he belongs to 7th to 6th century BC. The word meaning of Sushruta, Su means good and Shruta means heard. Who is good at hearing means what is the meaning of that? So once he hear, he can remember the things. That is the meaning of Sushruta. And the another meaning of Shruta is renowned. What kind of renowned? Is a well renowned. That is the Sushruta. In Sushruta Chikitsasthana, second chapter, third shloka, he says, Dhanvantari dharmamrutam varishto vagvisharadaha vishwamitra sutam shishyam rishi Sushruta manvashat. Dhanvantari dharmamrutam. Dhanvantari Dhanvantari sampradaya. He belongs to the Dhanvantari sampradaya. So, and he is the Shishya of the Dhanvantari. And he is a Rishi also. What kind of Shishya he is? He is a Varishta Shishya. He is a Vagvisharada Shishya. And he is a Vishwamitra Sutam. He is the son of the Vishwamitra. Varishta. He is a better student. And Vagvishara. He is not only good at hearing, he is good at the literature also. He is good at the speaking also. In the another reference in the Uttarathanda 18th chapter 3rd shloka we get Vishwamitra Shashashat Shishyam Kashi Patir Munihi. So he is the Shashashat means a Putra of the Vishwamitra and he is the Shishya of the Kashipati. Kashipati means the king of the Kashi Pradesha. Who was the king? Dhanvantari was the king. Dhanvantari, we get another reference of Dhanvantari who got the birth at the Samudra Mantana, that is also Dhanvantari. And another Dhanvantari is the Kashi Raja, is also called as the Devodasa Dhanvantari. So as he told, he himself as a Rishi and Vishwamitra was also Rishi. There are different Rishis we get. In the Amarkosha reference, we get the different types of Rishi. Sutrarshi, Gandharshi, Paramarshi, Maharshi, Rajarshi, Brahmarshi and Devarshi. The intention of becoming Rishi is to attain the Brahmadhyana. The Sutrarshi, Gandharshi, Paramarshi, they will be having Jnana Chakshu. Maharshi, Rajarshi, Brahmarshi and Devarshi, they will be having the Divya Chakshu. After the fourth stage, they will be having all these are having the Brahmadhyana. Maharshi is also having the Brahmadhyana, Rajarshi also having Brahmadhyana, Brahmarshi is also having the Brahmadhyana, Devarshi is having the Brahmadhyana. Then what is the difference? The difference is Maharshi is the Brahmadhyani, means who is a Rishi also, and Rajarshi is a Rishi, but having the Rajadharma means obeying the Rajadharma as well as the Rishi Dharma. Brahma Rishi is the Rishi means who comes under the Saptarshi. And Devarshi is the Deva also and Rishi also, like a Narada Maharshi, Narada Devarshi. Brahmarshi, that is Saptarshi. Rajarshi, the Raja as well as the Rishi, like a Janaka Maharaja, that is the father of the Sita. And Maharshi. So these are the different stages of attaining the Brahmadhyana. So for each Manvantara, there is a different group of Saptarshi will be there. One Manvantara is the combination of one Satyayuga, Treta Yuga, Dwapar Yuga and Kali Yuga. Altogether, it may comes around 30 crores years. For each Manvantara, one Saptarshi Varga will be there. In each means at present, in this Saptarshi Varga, Vishwamitra is one among them. Coming to the genealogy, Varuna has given birth to the Bhrugu Maharshi. Bhrugu's son is Chavana Maharshi. Chavana got married to Arushi. Arushi is the daughter of Manu. Chavana Prasha is the contribution of the Chavana Maharshi, hence it is called as Chavana Prasha. Chavana Maharshi has given birth to Aurva. Aurva has given birth to Ruchika. Ruchika also is a Rishi. Ruchika married to Satyavati. And because he has spent all his life in the tapas and all, so in the olden days of the Ruchika he married to Satyavati, and Satyavati wanted to conceive for a brahmina putra. The who are all take the birth in the brahmina kula, they won't become brahmina. So on those days, the caste was based on the karma pradanya. Now we are is a varna, means later on the varna pradanya, and the nowadays who are all take in the lingayata kula, they will become lingayata. Who will take the birth in the kshatriya, they directly become kshatriya only. So on those days it was not like that, based on their karma, that is the work. So they used to decide the caste. So Satyavati wanted to give the birth to the Brahmina Putra. So Ruchika has prepared some medicine for her and given, and simultaneously she was the only daughter to her parents, that is Gadi Maharaja. And she asked the medicine for her mother also to have the Kshatriya Putra, because she was the only daughter and someone has to be there to look after the kingdom. So she wanted to have a medicine for her mother also, and Ruchika has prepared one medicine to get the Kshatriya Putra also. And somehow the medicine got exchanged, and the Satyavati consumed the Kshatriya Putra medicine and her mother consumed the Brahmina Putra medicine. And when she got conceived, and Ruchika has identified Kshatra Tejas on her face. When he told the same thing to Satyavati, Satyavati has begged him to do something because she wanted to have the Brahmina Putra only. He can't stop that. So he has what he did, he has postponed the one generation ahead. Hence, she has given the birth to the Jamadagni, who has become the Brahmina, and Jamadagni Putra, that is Parashurama. Parashurama has become the Kshatriya. Jamadagni, as you know, he married to Renuka Devi, Yellamma Devi, and the Parashurama is the son of the Jamadagni. And Parashurama has become Kshatriya because of this medicine, even though he has taken birth to the Jamadagni. And simultaneously, her mother, that is Satyavati's mother, has given the birth to the male child, who has become, initially he has become Kshatriya, then he was known as a Kaushika because he was a king of Kaushika Pradesha. That is, his name was Vishwarata. And somehow later on he has become the Brahmina, means that is later on he called as the Vishwamitra. When he was a king, that is Vishwarata, he met with the Vashishta Maharshi, that is a Brahmarshi. And there he has identified the Nandini. Nandini is the Kamadenu, who is the daughter of Surabhi. Nandini, Kamadenu, and he wanted to have it. But Vashishta Maharshi refused to give so, and he got the battle with the Rishi, and he has thrown whatever the Shastra he has over the Vashishta Maharshi, and the only one thing which has protected the Vashishta Maharshi is the Brahmadanda. So he has engulfed all his Shastras, all his powerful Shastras, and simultaneously in that battle, Vishwarata has lost his 50 of his sons. He lost all his sons in that battle. On that day, he has decided, or he come to know that the Kshatra Tejas is nothing in front of the Brahma Tejas, so he wanted to become the Brahmarshi so that he can kill the Vashishta Maharshi. And he left his kingdom to his one of his son, and let he traveled the path of becoming the Rishi, Sutrashi, Brahmarshi, all those things, and later on he become the Brahmarshi, or Saptarshi, one among the Saptarshi. We know the when he was doing tapas, the Menika has come, and she given the birth to Shakuntala. Shakuntala married to Dushyanta has given the birth to the Bharata. Bharata has ruled this place, hence our nation is called as the Bharata. So many peoples are not known about the Gratachi. So when he has married to Menika, that was he was doing tapas. When he became Vishwamitra, as I told, in the path of this, he has killed 50 sons of the Vashishta also. So to do the Paschatapa, he wanted to give the bali of 50 of his sons, Vishwamitra's sons. So at a time, or within a very short time, it is impossible to have 50 of his sons by the normal lady. Hence, he married to another Devakanya, that is Gratachi, who has given birth to 100 of his sons, and among them, 50 of his sons get died. And the people who has remained, we get the reference of those peoples, that Madhuchanda, Akshini, Shakunta, Babru, Kalpata, Sthuna, and Sushruta. In the Vishwamitra Purana also we get the reference of Sushruta as the son of the Vishwamitra, as well as in Sushruta Sanhita Purvarda or Uttararda. In the both we get the references as he is the Vishwamitra Sutaha. He is Sushruta is the son of the Vishwamitra. So Gratachi, the another name for Gratachi is Bhagavati Kaushaki. What are the contributions of Sushruta? This is about the history of or genealogy of the Sushruta. Coming to the contribution, for any proper surgical outcome, we need to have a proper anatomical knowledge, proper anesthesia, and proper skill development. In all this field, also Sushruta has given his great contribution. He used to take body for body selection. Also, he has given the criteria, and the who attain all those criteria, he has to take that body and wrap in the grass and put in the iron cage, and that cage has to be put in the running water for 7 days. Afterwards, that body can be easily dissected. So, because the body has got decayed partially, and by lifting the layers, we can identify layers by layers without much effort. Because on those days there was no microscope, there was no uh, gadgets to magnify and view. So it's a wonderful concept he brought. Means he has given the knowledge of the anatomy. And see, just giving the few examples, he has explained the Pravahini, Visarjini, Samharani as the Gudavalis. There is the walls in the rectum. Later on, which are published and properly identified by the Houston, and we call it as the walls of Houston, but we forgotten the contribution of Susrutacharya. So it's much long he has told the presence of Godavalis in the form of Godavalis, but we call it as the whole walls of Houstons. He has told the many different incisions, circular incision, based on the different areas, because he was having the knowledge of normal skin creases. But the thing is, we call the normal skin creases as line of Langhurst. Once again, he lost the recognition. So he has told the different suturing also, like Rujuganti, Velitaka, Tunna Sevani, and Gofanika. Till the same methods, till now we are using the same method of suturing, like interpret suture, subcuticular suture, Gofanika means mattress suture, and continuous suture. So these are the four commonly used methods, still now, which are told by Sushruta long back. And not only he is worried about the skill, he has given a great contribution of the different classification. I take a one example like yantra shastra. Yantra means blunt instruments, shastra means sharp instruments. In the blunt instruments also there are some classification like swastika, sandonsha, tala, nadi, and upayantras, etc. So why he has to classify the things? Because he not only worried about the skill development, he is worried about the teaching also, proper teaching. For proper teaching, we should have a proper classification of the things. So here, for not only the disease, for instrument he has classified, suturing he has classified, suturing materials he has classified. There are so many things he has classified. See, I'll take one example. He has given Nadi Yantra. Nadi Yantra is a blunt instrument. One among the classification Swastika Sandonsha Tala Nadi. Nadi Yantra. That is a tubular instrument. Tubular instrument, he has given the four uses of tubular instrument. Roga Darshanartha. You can use the tubular instrument for the visualization of the Roga, diseased part. Achushanartha, to do the suctioning. Shrotogata Shalyodharanartha to remove the foreign body, and Kriya Saukharyartha to do the some other procedures through this tubular instrument. So best example for this is upper GI endoscope. We do all four functions which I explained by Sushrutacharya by using this tubular instrument. See, in the Sutrasthana of 17th chapter, he has told the anesthesia means to use the wine or madhya. See, he tells give food and madhya which can prevent the person sinking down. That is, it will prevent the person to move into stage of apnea. He has told in the fifth chapter, Abhuktotaha karma kurvitaha. You have to do the surgery without giving without giving the food. Examples are Modagarbha, Arsha, Ashmari, Bugandhara, and Udaroga and Mukharoga. Apart from these diseases, the rest of the diseases has to be operated after giving the food, and then you give the madhya and then you operate. Means he was aware about the stage of surgical anesthesia. So you have to prevent the patient to be getting awake, and as well as you have to prevent the patient moving sinking down, that is moving into a stage of apnea. So he tells that clearly, he tells that the giving the food will prevent the patient sinking down. So he was having the knowledge of balanced anesthesia, but we call it as the father of balanced anesthesia is John Runde. So, and he not only bothered about the skill and the teaching, he is bothered about the patient safety also. So before going to the surgery, the patient means the person has to be skilled properly. So hence he has told the Yogya Vidhi Adhyaya. So in that he tells the person should practice the surgical skills on the different specimens, different models. Afterwards, once he become perfect in doing the procedures on the models, afterwards only then he has to allowed to perform the procedures on the patient. Not only that, he knows many things, like he was aware of the using chemicals, the Kshara alkali substance he has used. He used the leeches. Till now we are using the leeches for the venous congestion and all. He used the fire to attain the hemostasis, means to arrest the bleeding, and he used the fire to sterilization, means disinfection. He used fire to for pain relieving purposes, which is still obscure, which is not still properly, means not has come into the mainstream. And he has given the different types of bandaging. He has explained different types of fractures, dislocations, and many more things. He did laparotomy, craniotomy. He did pipilika prayoga, like this one, ants to suture the perforated area, and Baddha Gudodara. He did for intestinal obstruction and perforation, and he did cystolithotomy. So many operations he did, more than 300 operations he did, and he has explained a fine rhino reconstruction, that nasal reconstruction. He explained the nasolabial flap to reconstruct the nostril, and in the 1440 later somehow it got modified by someone, and he has explained the forehead flap. So till now we are using the same method of nasal reconstruction, which is called as the Indian method of reconstruction. See, there are many contributions of the Sushruta. Dr. Professor G.D. Singhal, he is a MBBS MS surgeon, and who is also called as a pioneer of pediatric surgery in India, and he was the first president for the first national conference of pediatric surgery. He says that justice has long been denied to the Sushruta of India. He should have been called as a father of surgery long ago. It's a still time. The world have recognized the recognition to Sushruta and his pioneering work. Anyone contributing in any way towards this would be doing a service to the nation and also helping to the cause of the history of medicine in general, that of India and Ayurveda in particular. So these are the words of Dr. Professor G.D. Singhal, who says justice has already delayed. So if the delayed justice is nothing but the denied justice to Sushruta. So this is the contribution of Sushruta, and this is what the recognition he got. So this is just Aja Gajantara Antara. So this is all about on the day of Sushruta Jayanti. If you like this video, then kindly subscribe to the channel and press the bell icon. Thanks for watching the video.